So thank you very much for the opportunity to speak with you today. I've been asked to talk just for 10 minutes on how workers in the United States, California, and other states can protect their health and safety on the job, since that's obviously a priority for everybody at the moment. And there are really three parts to that, I think. One is to know what your rights are under the law. Even if that law isn't enforced or respected, it's important to know what your rights are. Secondly, what the limitations are for the health and safety enforcement system that we have in the United States. And then thirdly, what workers through collective action have been able to do, not only in the United States, but around the world in order to protect themselves. So first of all, on knowing your rights, actually here in California, there is a specific standard, a regulation which is enforceable that deals with aerosol transmissible diseases, precisely like what we're dealing with COVID-19 at present. It's Title 8 of the California Code of Regulations, if anybody wants to look it up, Section 5199, the ATD standard. And it's been in effect about 10 years, and it's fully enforced here in California. Now, it's limited to a certain number of job classifications, which are mostly related to healthcare, so it covers, for example, all healthcare facilities, services, and operations, and that's everything you could think of, from hospitals to long care settings to nursing homes, et cetera. But it also includes a variety of other settings that it's important for people who may be in that field to realize that they're actually covered by this regulation. That would include facilities, services, and operations that are receiving potentially infected people, police services, particularly for the transport and detention of potentially infectious people, all types of public health services, jails, homeless shelters, drug treatment centers. Also, as you might imagine, the coroner, the morgues, pathology labs, research labs are covered. Also, maintenance personnel that are handling the heating, ventilation, and air conditioning systems for facilities that might have potential contamination by the virus, such as the COVID-19, and then any others that are designated by Cal OSHA. But for people in California that aren't in those workplace areas, there's still an existing regulation that requires that your employer guarantee your health and safety. That's called the Injury and Illness Prevention Program, or Section 3203. And that requires that all employers in the state of California identify, evaluate, and control workplace hazards, which would include infectious diseases such as COVID. Now, for everybody outside of California, there are still regulations that would cover you. Under the OSHA system, which covers exclusively about half of the states and the 50 around the US, they have what's known as a general duty clause, which is a requirement on the part of your employer as its general duty of functioning to ensure, as the Injury and Illness Prevention Program does in California, the protection of people's health and safety by recognizing, evaluating, and controlling all hazards. There are other state plans, such as Oregon or Washington, which have other very good state plans. And then, unfortunately, there are other state plans, such as Utah and North Carolina, for example, that are really bad state plans and designed to be so. But there also exists in those states this general duty responsibility. Now, secondly, even though that these laws exist, unfortunately, there are limitations to them here in California, but also federally in terms of the occupational health and safety standards, is that there are severe restrictions or vacancies, rather, in terms of staffing for the field inspectors, like I was for 20 years. There's 50 vacancies out of an inspectorate of about 240 inspectors here in California. So we have a 20% vacancy rate among field inspectors. I think the federal level is roughly equivalent to that. In addition, unfortunately, both OSHA and Cal OSHA have adopted a stance where they're not conducting inspections, enforcement inspections at the present time. What California is doing is what's called an inspection by letter, which means basically they send a letter to the employer, having received a complaint from a worker, asking what is the employer doing about protecting employees about a given hazard. In this case, it could be COVID. But it could cover, and it covers all kinds of hazards. It could be chemical exposures, noise, ergonomics, et cetera. Basically, no inspections are being done either at Cal OSHA or Fed OSHA. Now, that's also true, unfortunately, with the other right that I meant to mention, is that under both California and national law, every worker has a right to express concern about their health and safety conditions without fear of reprisal or discrimination by the employer. Now, everybody knows how much that's enforced in the best of times, but that right exists, and it's important that workers know that they have the right to express concerns without fear of reprisal and discrimination. Workers also have the right to so-called refuse unsafe work. And unsafe work is defined in a way we could talk about later, but it's another important right that workers have, not only in California, but around the country, the right to refuse unsafe work. Now, there are limitations, unfortunately, on that as well, because it's not Cal OSHA in California that enforces that, but rather it's our sister agency, the Department of Labor Standards and Enforcement, or DLSE, or the Labor Commission, as it's known here in California. And unfortunately, the Labor Commission, before this hazard, had a grand total of five inspectors for a workplace of 19 million in California to conduct discrimination reprisal investigations. And it takes more than 15 months for any of these investigations to be actually completed, and most of them are resolved in favor of the employer. So this is obviously a big problem, and it means for us actually that our political activists, union activists and like is to on one hand realize we have the right under the law not to be discriminated against, but understand in the real world you have to have a plan B in order for that to be actually undertaken. Unfortunately, it's Fed OSHA that does the investigations on a national level, but they would include whistleblower type of complaints, not only about health and safety, but also on more than 15 other agencies and laws. So the anti-discrimination division or department of Fed OSHA is also completely swamped, and I think does a very poor job of protecting whistleblowers, not only about health and safety, but also about all the other 16 regulations that they're supposed to enforce. So, okay, so understanding that, what can people do in general, but also in this particular situation to protect their health and safety? And I think there's quite a bit that people are probably familiar already that working people are doing. And the key to this is collective action, is to working together to defend your rights and to make requests on the employer, on the government, that they should respect those rights, and particularly health and safety. So what we all have the right to do, and what workers around the world are doing, is to collectively demand that employers eliminate all unnecessary risks associated with COVID, and then reduce the risks which may not be foreseen or exist because of the nature of the job. That's the responsibility of the employer. And it's and probably an important way to figure that out is that there's an organization many people are probably familiar with called Labor Notes in Detroit. They put out a magazine, but they have an excellent website which includes reports on what working people are doing around the country and around the world to exercise their rights around health and safety. They're going to be doing, I think, an all-day conference next Saturday, the 18th of April, on how to protect your health and safety on the job. So it might be worth people talking about or tuning into. So there's two aspects to this. Of course, if you have a union on your workplace, in your workplace, then you're much better protected than you are if you don't. And then the unions around the country and the world have been very successful. You have the Detroit bus drivers, you have auto parts manufacturing workers in Detroit also have done strikes and walkouts in order to improve health and safety around COVID itself. The United Food and Commercial Workers Union, Local 5 here in California, Local 400 on the East Coast, have gotten really an exemplary list of demands approved and implemented by their employer. General Electric aircraft workers in Massachusetts have gone out on strikes and walkouts to demand that the plant be repurposed for the production of ventilators as opposed to military jet engines. In Kentucky, auto workers have walked out. Teachers have done so, of course, in New York, in Chicago, Los Angeles, and hotel workers in New Orleans just yesterday were involved in a big job action to protect their health. Now, it also means that non-union workers actually have rights under federal law, again, with the caveats that it's difficult to enforce that. But if two or more workers, regardless of their union status and regardless of their immigration status, work together on health and safety issues, that's called concerted activity. And it's protected under the National Labor Relations Act. And again, workers have the legal right to engage in concerted activity and not face reprisals and discrimination. Now, in the real world, that all depends on the relationship of forces between the workers and their employer. But that exists legally, and it's important for people to recognize that. So undertaking that, a lot of workers around the US have actually exercised the right to concerted activity. For example, Purdue poultry workers in North Carolina and other parts of in Arkansas have walked out or conducted mini strikes around health and safety issues. We all know about the Amazon warehouse workers in New York City, also Whole Foods, grocery workers around the country, Instacart workers, which I guess are people that do personal shopping for particularly elderly and infirm people. And then garment workers in Los Angeles are about to mount a campaign on that as well. So it's true for both union and non-union workers, and that's important to recognize that it's this collective action utilizing all the legal protections that exist and working together demand that the government and the employers meet their responsibilities have actually had success in this area. Now, there's also a whole range of international activities, which I don't really have time to go over, but a couple of them are kind of interesting. Italy, of course, which has had a terrible experience with this virus, thousands of deaths and hospitalizations, have had really exemplary workplace activity to improve working conditions and public health conditions, including medical workers, grocery workers, warehouse workers, heavy industry of all types. And they've also negotiated on a national basis a so-called shared protocol on March 14th, which established ways in which business, if they were allowed to remain open, had to follow in order to protect the work and safety of their employees. And I think a lot of the information there is up on the Labor Notes website. Also, there's been some governments around the world which I think indicate activities that should be modeled by our own government. For example, even governments with a lot less resources, such as Cambodia, Sri Lanka, Indonesia, India, and South Africa, have all guaranteed full pay for workers or parts of industrial sectors within their countries, which is something they could and should do in the United States as well. Not only the question of paid leave, but there's lots of informal workers, gig workers and the like that don't exist in the formal sector that need their income protected as well as their health and safety. So two other aspects besides concerted action on the job that I think workers can use to their advantage at this time, one of which is media work involving taking a case, taking a set of circumstances which presents a health and safety hazard to workers to the news meeting, to the radios, the televisions, newspapers. There's quite a bit of stories out there today, and I think the news media indirectly exerts a fair amount of pressure on employers and also the government to do so. And then lastly, I think that people should take advantage, even though some of our elected officials are somewhat less sympathetic than others. These are elected officials that have a responsibility to their constituents, and working people are their constituents. And so I think we have a right, wherever we are in the US, to demand that our elected officials look out after our health and safety, because that's exactly what they're hired to do. And again, all this has to be measured in the real world and what's possible to do, what the relationship of forces are, how much resources anybody has, the like. And then to finish, I would just like to say that there's two other aspects that I think it's important to keep in mind in this time. One of which is that it's really inspiring to look at what I consider to be working class solidarity. That's a lot of the human solidarity, and most humans on the planet are working class people. But the working class solidarity that's being shown in our country and in other countries as well, where people are looking after doing child care for healthcare workers and other essential workers so that the parents can do their jobs to look after the rest of us. All the food bank stuff, looking after one's neighbors, especially the ill and the elderly and the infirm. This, in my view, is working class solidarity, which shows that another world could exist and can exist. And it shows how people rise to the occasion under very dire circumstances. I'm sure New York, for example, or New Orleans, and hopefully we'll miss it here in California, but nobody knows. And then the last thing I want to say is that I think this whole crisis, especially for those of us that are political activists and socialists, raises the opportunity to have a deeper discussion with people. I think we're going to have to wait, obviously, till the peak is past, and God forbid we should have a second wave in the fall, as may be possible. But I think there is among working people, which again are the majority of our compatriots in this country as around the world, have had their eyes open as to what this healthcare system is able to do or not do, and to protect people that pay into it, that they're totally dependent on it. And I think the whole idea of a deep discussion with our coworkers, our friends, our neighbors is that how can we, having seen the terrible inability to do this on the part of the government and the employers, now how can we reorganize society so that we never have to face this again, or we can face it in a much better world? So I think another world is possible should also be one of our slogans during the course of our work, as well as the Italian slogan, which I think is great, which says health first, then profits. So with that, I'll stop, and my contact information was just flashed up on there on the board. I'm happy to talk to anybody. Probably email is the best. And then the two websites that I indicated there are one on Inside Cal OSHA, which is what I do on Cal OSHA related issues. And then I've been working in the international arena, mostly with worker and community groups around the world since 1993, in a little NGO called the Maquiladora Health and Safety Support Network. And the websites for both of those are up there.